In the Asian American and Pacific Islander community, just as I think the community at large, one of the things that HIV and AIDS did was also really propel a lesbian, gay, bisexual, transgender movement of visibility and ultimately of acceptance and integration. I didn't come out until I started working on HIV and AIDS issues, and it was, I think, partly because of my work on HIV and AIDS that was important for me to be out as gay and to say that I am at risk personally and that this is important to me, not just as an issue for our community, but for me as a person. And so I think there really have been these parallel movements in our communities of responding to HIV and AIDS, but also building a sense of identity as lesbian, gay, bisexual, and transgender people, as queer people, and then ultimately assuming roles of leadership. I started doing HIV and AIDS work probably in about 1988. I was attorney out of law school about 3 years. President Reagan made his first infamous speech on HIV and AIDS, and among the things that he called for was the mandatory testing of all immigrants for HIV. And so that became an issue that I started to work on. By 1988, was really active all the way through protesting the International Conference on AIDS that was here in San Francisco in 1990, and then eventually by 1995 took a full-time job coordinating a national program working on HIV and AIDS in the Asian and Pacific Islander communities. When I first started being invited to meetings at the Centers for Disease Control and Prevention in the late 1980s and into the 1990s, I would go and there would be presentations about how HIV and AIDS were affecting different communities. And all the data would be reported as white, black, and other. And there would never be any data reported about Asian Americans. And so this is an issue that I've worked on probably for 30 years of how do we get counted? Because as a saying goes, if you're not counted, then you don't count. If we don't ask the question specifically, what is your racial or ethnic background? And then ask it more specifically, are you Chinese? Are you Japanese? Are you Thai? Then we won't know where we need to target resources and where we need to focus our efforts. One of the facts that we often overlook is that the very first federal or any kind of funding that went to Asian American communities was actually in Minnesota. So it was in the middle of the country, an organization applied for a grant and got the very first grant. In the 1980s, probably around 1985, 1986, there were almost simultaneously organizations that began in San Francisco, in Los Angeles, and in New York. Eventually, over time, there were probably close to 70 organizations that were doing some kind of HIV and AIDS work. And this was by probably the year 2000. So in that space of 15 years or so, there was this remarkable growth of organizations. Most of those organizations have no longer exist, have gone out of existence. The ones that have survived and have thrived, many have now expanded their mission beyond HIV and AIDS. Particularly in places like San Francisco and Los Angeles, the outreach to the transgender community was one of the pioneering things that the Asian and Pacific Islander HIV/AIDS organizations did. From very, very early on, these organizations were founded in the late 1980s, and probably a year or two into their existence began that kind of outreach, literally on the streets, because that's where the transgender women were. There were no community spaces, there were no organizations for trans folks at that time, and so the only time you could find trans folks were on the street. There were early educational programs focused on trans women by the Asian AIDS Project, probably as early as 1990. And then in Los Angeles by Asian Pacific AIDS Intervention Team did a trans program very early on in the 90s. And programs were designed and implemented by transgender women who were Hawaiian in very early stages of the work in Hawaii as well. One of the commonalities of Asian American and Pacific Islander communities, of Asian and Pacific cultures, is the importance of family, perhaps more so than in other cultures and societies. And so when it comes to HIV and AIDS, not having family support is obviously really, really significant. And early on in the epidemic, we would use different terms. So rather than talking about coming out, we talked about facing out. And there's this concept about saving face, not bringing shame to the family or to the community. And so that was a different way of saying, by coming out, I'm not bringing shame. I'm actually showing my face, showing who I am, but that can also honor my family, and my family can be part of that process. I was often asked this question of, are there particular barriers to doing HIV work in Asian American and Pacific Islander communities? And my response is always, stigma is stigma, homophobia is homophobia, and fear of death and dying is fear of death and dying. It has different cultural nuances. Generally, we're not used to talking about death and dying. We're not used to talking about sex. We're not used to talking about intimate relationships and what that means in our lives. The myth of the model minority was invented by a journalist in the 1980s that said Asian Americans are the richest, the best educated, the best well off, and really the model minority that other minorities, particularly African Americans, should be ascribing to. I think it doesn't help our communities when we're characterized as the model minority. It doesn't understand the diversity of our communities, the fact that there are individuals in our communities who don't have higher education, who don't have employment opportunities, who are struggling, and who may not speak English or have come to this country under very, very difficult and challenging circumstances as refugees. It's also a wedge to divide Asian American communities in particular against other communities of color and not allow us to identify as communities of color as we should be. When in the 1990s, African American and Latino communities in the United States really began highlighting the disproportionate impact in their communities, one of the things that we did from an Asian American and Pacific Islander standpoint was express our solidarity with them and say that more resources should go to African American and Latino communities in proportion to the way that the epidemic was impacting those communities. We received some negative feedback from our own communities of why we're standing up in solidarity. But I think it's really important that if we are honoring the science and the epidemiology and saying resources should be proportional, when it comes to prevention, there should be resources for everybody so that nobody gets infected. But when it comes to care and treatment, yes, it obviously should follow what those numbers of who needs those resources the most should be.